Check back with you, Aaron. Thanks very much for that. 6:02 right now. Vaccinating Maryland against COVID-19 is not happening as fast as doctors or people who want the vaccine would like. More than 400,000 Marylanders have gotten their first dose of one of the two available COVID vaccines, but tens of thousands are still waiting for their turn. WMRT News' Mark Roper is live this morning. Mark, at this point, there appears to be a simple question of supply and demand.
Yeah, Christian, that's unfortunately the problem that the state and people who want the vaccine are facing. And the first step to getting that vaccine is to register online, and you can do that online or making a phone call to one of the state's vaccination sites like a hospital or your local health department. But pre-registering online doesn't guarantee anyone's getting an appointment anytime soon.
86-year-old Lenny Lebowitz is one of thousands of Marylanders waiting to get vaccinated against COVID-19. She tells us she signed up online with the Baltimore County Health Department as well as several hospitals, but so far, the only thing she's received is an email.
You're on a list. Meanwhile, they've opened up to a new phase. People I know that are 65 and over have already gotten shots. And I'm sitting waiting.
Baltimore County Health Director Dr. Greg Branch points out a common problem facing health officials all across Maryland.
Once you're on the registry, it's going to be a while before I get to you, only because I don't have the vaccine. If I had enough vaccine and I was able to do 1,000 an hour, and I was doing this for 8 hours a day, and I'm getting through 8,000 people a day, obviously I can get to my registry very, very quickly.
Instead, health officials report a short supply of vaccines makes the process of vaccinating Maryland move a lot slower than they would like.
I can vaccinate, with my current supply, I vaccinate 500 a day. And you can easily do the math. If I have 20,000 in my registry and I can do 500 a day, that's looking like 40 days to finish the list of 20,000, which is going to grow.
And we want to get them vaccinated as soon as possible. But we can only do what we can with the supply that we have.
There's at least 80,000 persons registered waiting for the next email to say, come and get your vaccine. And this week, I'm expecting 4,500 doses. I'm sad and frustrated for my community that we can't provide them the doses that they so desperately want.
Phase 1A vaccinations of frontline healthcare workers and first responders began in mid-December. Since that time, Maryland moved on to Phase 1B, vaccinating seniors over the age of 75. And in late January, the state entered Phase 1C, vaccinating people 65 to 74. And while the calendar advanced to vaccinating Phase 1C, many county health departments have not.
It's hard to manage those expectations that people have that, well, I'm in 1C now, I should be able to get the shot. Well, I've not nearly made a dent in all the 75 plus and the school teachers and everything else that I'm supposed to vaccinate in 1B.
The Biden administration promises more doses of the Moderna and Pfizer vaccines are on the way. And now a third vaccine from Johnson & Johnson is on the horizon.
The federal government just said they're going to increase it by about 16%. That's going to help pick up the pace.
Until then, registering early won't up your chances of getting vaccinated sooner than later.
Just being first in line in this situation, those rules of I was first in line, I get the Black Friday TV set. That's not the way this works. So if you're pre-registered, it's really going to be random when your group is up.
Scheduling those appointments is a challenge in itself for health officials.
We want to get the vaccine in those arms that are the highest priority. And what we essentially do when we get vaccine that comes in on a Tuesday, we're scheduling every one of those doses for the following week.
It makes it hard to plan more than about a week in advance. And I know that, folks want to know when they're going to get it. And once we get more certainty going out a few weeks or months, we can do more planning and set up more clinics.
Meanwhile, Lebowitz and thousands of other Marylanders continue to wait.
Annoyed. Wasn't really mad. I'm annoyed with this whole thing. It's frustrating. It's annoying.
People are getting frustrated. We're asking them to be patient, and we're signing them up, and we're going down the list as systematically as we can.
And I just want people to know and understand that we are working within the constraints that we are facing and trying very hard to meet the demands of the community.
Now, I have some good news to report about Lenny. We talked with her last Thursday, a week ago, and yesterday afternoon, she sent me an email saying that she finally got the email that she's been waiting for, and she now finally has that appointment to get vaccinated. Later this hour, we'll talk with health officials about the challenges of trying to vaccinate thousands of people during the pandemic. Reporting live, Mark Roper, WMAR 2 News.